to it.
Hello, hello. Camera issues here. All right, hi. Not what I was expecting. Hopefully you guys can see me. I cannot get this to work on my computer. I'm going to take my mask off. Sorry guys. I was hoping to have this on my computer so that I had a little bit more accessibility here. My computer will not play a live video. So hopefully this is working, and I apologize for being just a little bit late. So I am Kristen Steppe, pediatrician at Pediatric Partners, and I want to share with people a little bit about thoughts on getting back out into the community. We are getting so many phone calls, so many people are asking what they should do, and unfortunately it's not a quick and easy answer. A lot depends on risks in your family, a lot depends on risks in the community, and that's going to change day to day. So I actually have pinned on our office's news page that we update every day with different things, but one of the things that's at the top is our local risk. Johnson County Community has a page that has up-to-date testing numbers and everything else, and all of their recommendations. We are currently in Johnson County, Kansas in stage 1.5, which means we can have gatherings up to 10 people, and certain stores can be open, and there are still recommendations for various businesses. And as levels of the virus go down in a community, we're going to be able to up our phases, and that involves being able to do more things. But that also involves the risk of maybe being affected by coronavirus, and then if numbers go up, we'll have to change phases back down. So what can we all do as we start to get back into the community to keep ourselves safe? And I know some of that's going to depend on personal risks. If you are not willing to get exposed, then you're going to have to continue to stay home, but that involves risks as well. And so you have to look at the risks of not allowing your kids to play with other kids, the mental and physical factors with that. Physically, kids need to get out and play. So playing in your yard is a much lesser risk than playing on a basketball team. So looking at different risk levels. So everything that I'm going to talk about today is based on today, May, 19th, risks of today in my area. If I were in a different city that has higher risks, obviously that is going to impact your decisions. Somewhat it's going to impact your decisions based on who is in your household. If you are living with grandparents, if you have someone in your family that has one of the known risk factors for worse coronavirus disease, you are going to have to treat your family different than someone who is young, otherwise healthy. And while those people are not 100% guaranteed to survive and do well with coronavirus, they are definitely less of a risk. And for the most part, kids are lesser risk. I know recently we've had concerns with children getting admitted with this multi-inflammatory, I can't remember what they're calling it today. It was called Kawasaki-like syndrome, but that involves lots of different systems within the body, like heart, kidneys, lungs, that can be affected. And these kids can get really sick, but overall those numbers are still very, very low. Most kids are doing very well with this. So if you are a family that has been, for the most part, healthy, and you now want your kids to get out into the community, what kinds of things can you do? Or if you're a family that has parents that must start to work outside the home or have been working outside the home, what can you do to keep your family healthy? One of the big things would be trying to do outdoor activities, things where you can still space yourself. 6 feet or more is considered safer than close confinement. So outdoor activities, going for walks, riding bikes, those are definitely safer than going to another person's house even, because you have limited airflow inside a building. Teach your kids to wash their hands. Hopefully they've been practicing washing for 20 seconds or using sanitizer, getting all parts of the hands, front, back, fingertips. A lot of people forget the hands here, the wrists. Teach kids how to properly wash their hands. Have them do that before they leave the home. after they get home, of course after toileting, before eating, ideally before touching their face, and before putting on a mask, which I do think is a very protective measure. I know there's a lot going on now about masks. We see volumes of these fears with masks. The overall majority of people believe that masks help. There are a few very vocal people, just like with other things such as vaccine. The majority of people believe in it. There are a few very vocal people that you hear a lot about the negatives, and unfortunately those aren't necessarily founded in science. Part of the confusion with masks is when they first, the CDC first stated not to use masks in public, it was because they wanted to save the medical grade masks for medical healthcare workers. They were in short supply, they still are in short supply, and we still don't want people using medical grade masks out in public. We want people to use cloth coverings. I'm not working today, so I have just my cloth covering mask. Tightly woven fabrics are safer than things that allow bigger droplets to go out. But masks can definitely help the wearer from spreading the germs. Another component, an argument that people will say is that masks have not been proven to not catch disease. And that is completely true. These cloth masks do not prevent the wearer from getting sick necessarily. They prevent the wearer from spreading respiratory droplets, which might get others sick. So wearing a mask is very respectful to other people, basically. It is helping to stop the spread of disease. And there are some studies now that show that if 80% of people wear a mask, that can significantly decrease the risk of infection spread. So that is fantastic. And a lot of parents are concerned that their kids are not going to do it. And I know that it's hard for kids. It's even hard for adults with anxiety or other conditions where they feel that ear hunger, that fear of wearing it. Practice makes perfect. I think if you start with very small, have kids play with it with their stuffed animals, have them wear it for fun, play superhero or something wearing their mask, make it fun. Masks come in all kinds of cute little fabrics, so kids can enjoy it with that aspect of it. And then teach them how to properly put it on. Wash their hands first, handle it from the earpieces, and then try to put it on without touching the face and not adjusting it too much. If I need to adjust it, I can try to adjust from the sides, and I actually do have my sanitizer here that I use to before and after touching the mask. I'm going to take it off because it's harder to hear online, I know. But teach kids how to properly use a mask. If kids will not wear it, we also know that kids don't spread the disease as much as adults. So it's really important for adults to wear their mask, to model that good behavior. But if kids won't do it, if they constantly play with it, I do think it's safer for them not to wear it. Because if their hands are touching dirty surfaces and then their mask, they're bringing those germs right to their face. So if you know your child will not yet wear it for a prolonged time, don't encourage that outdoors. But you can practice at home, because if they wear it for short times, they can get used to wearing it for more extended times in case they're required to wear it for school, which very might well happen for the older kids especially. And I'm not privy to those discussions, but I would not be surprised if schools do require it come fall. So masks, hand washing, not touching your face. If you are going to be in the areas where there are public surfaces, try to keep those areas cleaned. And that's going to apply to daycares, that's going to apply to camps, sports, if they use common sports equipment, cleaning the equipment before practice, encouraging all the kids to wash their hands at the start of practice. If they touch their face, if they touch common surfaces like a ball, a bat, ideally not have common things like bats used. Everyone has their individual bat if they're playing. Certainly no sharing of gloves, mouthpieces, ever mouthpieces, that's disgusting. But trying to limit this shared touched surfaces as much as possible, unless those can be wiped and cleaned down. If there are going to be group gatherings like sports practices, I know that's one of the biggest questions is, should your kid practice with the team? I know a lot of coaches have been great about doing online practices. Everybody's doing home whatever drills with a Zoom class type situation to help stay in shape, and I think that's important. I do know that there are some teams that are starting to meet. I do think that the current CDC guideline is officially to not have sports team practices, but I think the CDC is looking at the U.S. as a whole, and there are still pockets of places that are not safe, whereas there are certain communities that are safer. So I think each individual community needs to make their own decision, and each individual family within that community needs to make that decision. If you have a grandparent living with you that has COPD and other health issues, and you don't want your kid to go to practice because they can bring it home to grandma who is higher risk, that is a very different situation than if a family's overall young and healthy and think that their kids can avoid touching their face and washing their hands well. So you have to look at individual risk factors as well as community rates. If our rates in the community go up and you are no longer comfortable sending your kid to practice or have games, hopefully coaches will be understanding of that. I can't imagine in this community that people will be too horrible if your kid has to miss games or practices because of the risk being high, and hopefully no one will be pushed. I know in the past I have seen kids who feel like they still need to go to whatever competition or sport event despite knowing they have influenza. That cannot happen. If people know or suspect that they have coronavirus, they really should not be exposing other people. We need to constantly maintain this stay home if you are sick. If you can't get tested, but you have symptoms that could be coronavirus, presume it's coronavirus. If you are tested and it's negative, that doesn't even exclude coronavirus. I can put in the comments later a really cool chart that I actually just saw this morning on a conference call that shows what the false positive, false negative testing rate is. And unfortunately, we cannot use testing to guide our behaviors. We need to truly be honest with ourselves. If we do not feel well, we should not be around other people. We always should wash our hands. We should always try to keep that 6-foot distance as much as possible, wear masks at this point. And I do believe that's going to continue until we have either enough people that have had the disease, that will probably take a year or two, to build a population of people that are more immune, to have that herd immunity, or if we have a vaccine, which there are, I know, really some encouraging reports coming out of a new vaccine that just finished its phase 1 trial, but that doesn't necessarily mean it's going to make it. I think only 10% of phase 1 vaccines make it all the way to market. So we're still waiting to see about vaccines, and we're going to have to, for a long time now, use precautions. And I really think that that's one of the things that we need to take into consideration. We can all stay at home for a month or two. We just did, for the most part. But we can't do this for 2 years. We're going to have to get back into the community. And I know there's a lot of fear into doing that, but that's where we have to take our own family risks into consideration. And again, that will depend who's living in the home. My household is probably a little more dangerous than my neighbors. I know my neighbors have been home. They've allowed their kids to play in their yard, but they have gone nowhere. They order groceries. They have things brought in. They are very low risk. Both parents are working from home. Very low risk. Whereas my family, my husband and I both have jobs that require us to go out and about, so we have those exposures. I've actually started wearing a mask in my house just this week because now that we are opening up, I don't want to get my family sick. I don't want them then, as they start to get into things, having a higher risk, because I do have closer contacts with people. So unless I'm physically eating food, and I'm wearing a mask in my own home. And we don't have anyone high risk in my house that has COPD or any of the other risk factors. A lot of people have asked about daycares. And again, I think you have to assess your family's needs and risks. If you have to get back to work, you really don't have much of a choice. Daycares are probably a safer asking grandma who has COPD or is of the age group that is higher risk. If grandma is younger than 60 and she's otherwise healthy and she's willing to accept the risk of watching daycare kids, or watching your kids rather, grandmas can be part of that decision making, grandpas too, I guess. But again, they have to look realistically at their risks. If you are going to work, you're more exposed, and then the kids can give to grandma even if the kids seem healthy, because we do know that kids are more likely to have asymptomatic disease. If kids go to daycare, most daycares now are pretty good about not letting parents go in because they're limiting the number of people in the building. They are having drop-offs outside. They are sanitizing all of the toys. They're probably not using many shared toys. Kids have their own things, unless they can be wiped down pretty easily. Sleeping surfaces should be at least 6 feet apart. So the kids, if they have their cribs or their cots, those need to be separated. And then, of course, everyone has their own individual blankets and those types of things. Hopefully lots of hand washing with all of the providers inside the daycare. And I think they're supposed to limit what kids go to different areas, so that one kid is not in one room one day and the next day go to a different room because of staffing needs. And staff are supposed to stay with the same group of kids day in, day out for the most part, because all of that helps limit the spread amongst various families. So grandparents and daycare kind of go hand in hand, because a lot of grandparents are daycare providers for their grandkids. And so looking at that, if you cannot assume the risk of having your kids go to the daycare because of who lives in the home, sometimes people can have one nanny come into the house. There are a lot of college kids home right now. I don't know how long that will last. High school kids are home now. But having that one person come into your home, as long as they understand the risks if you were going outside the home to work, that is an option for many, many people. I had another thought there and I totally lost it. So if I remember, I will come back to it. Sorry, this is harder than I thought, like talking to myself. Oh, I know what I was going to say. Family pod groups have been suggested as a way to help kids socialize. If two families are of a similar risk group, you have the extreme where both parents work from home or the single parent works from home and the kids don't go anywhere, they order online, they have very low risks. Families of 2 to 3 can get together, or 2 to 3 families can get together, and then they have basically a written or unwritten contract with each other that they will disclose any risks. If they are potentially exposed, they'll let the other families know. But these kids can play together and they'll decide, depending on their risks and their comfort level, what these kids can do within that family grouping of pod, kind of a small community within a community. People who have different risk factors, like my family, I don't have young kids, but if I did, whoever gets in that pod group with me would have to accept the risk that I do go to work and I do have close personal contacts with people throughout the day. Though I use precautions, I wear a mask, we're asking our families here to wear a mask, those are the limiting factors that would maybe not let another family be comfortable with their kids playing with my kids. So those are the kinds of things that you need to think about, though. Your risks, your needs. If you have to go to work, your kids have to go somewhere. Mental health needs of your kids. They have to get outside and play. They have to be able to have some contact with people. And if it can't be physical contact, they still need that social contact. I have been opposed to the social distancing term for such a long time. I really want us to socially connect, physically distance. So if your kids can physically distance from other kids, which is easier for big kids. I know one of my young adult teen kids at my house had friends over. They all brought their own picnic lunches and they sat in our backyard. My daughter measured out 6 feet and put chairs more than 6 feet apart. They sat in a big circle and they just talked for a couple hours. That was great for them, and that works for high school, college age kids. It does not work well for preschool age kids. So risks you have to look at and abilities you have to look at. Talk to your kids. Have measurements of 6 feet marked in your house somehow. If dad is 6 feet tall, have him lay on the floor and have kids stand on either side of him so they can see what 6 feet looks like. Because if you just tell kids to stay 6 feet apart, even if you tell adults to stay 6 feet apart, what does that look like? And learning that distance can be helpful. So it really comes down to knowing your risks in your home, who lives there, what their health status is, what the needs of your family are. Do the parents need to go out to work? Or some of the teenagers are still working and they are more likely in high-risk jobs. They are working in fast food industry or retail places. So they bring risk to the home. regardless of risks, how can you stay safe when you go out? And the big things are washing or sanitizing often, wearing a mask, not touching your face, not touching your mask, staying as far apart as you can. I heard somebody quote the other day, and this is great: pretend everybody's smoking and you don't like cigarette smoke. Walk around them. That plume of smoke that surrounds somebody, you would walk around it. So do that when you're out and about walking around. And if you can maintain that kind of distance, if you're on a bike trail or walking trail and there aren't a lot of people, maybe you don't need a mask. But if you're going to be in areas that have closer spacing, bring your mask. They have so many cute masks now too. It's going to be the fashion accessory of the 2000s or the 2020s. So yeah, I'm glancing at my notes here. I think I've covered everything. We've got our awesome nurse manager, Becky, over here watching for questions. I don't know if she hasn't popped up anything. So if anyone has any questions, definitely ask. Because I think the big concepts have been covered, and it is going to be fluid. Today is going to be different than next week. I do think as our communities start to open up, we are going to see more disease, and then we're going to hopefully learn from that to wash our hands better, wear masks, and be safe. So I don't know. If anyone has any questions, definitely let us know. We are going to be doing these. I'm going to do next Tuesday again at 11:30, and then starting in June, each of the doctors on Friday is going to take turns, so you'll hear from different people. We'll have a general topic each week of whatever's going on, but always have questions too, and I will post 1 week in advance the information about these, so you can post your questions under that so that whoever is speaking that week can cover the questions. This week I only had one sent to me about the sports, and really that's going to be a combination of how old are the kids, what is the sport. I guess I didn't say that. I definitely think things like golf, where you're standing back because there's a big stick, much safer than basketball where you're in somebody's face, wrestling where you're in somebody's face. Those are sports that are going to take a little longer, because if you can keep that distance, it's going to be a lot safer for everyone involved. Coaches should probably be masked up. Kids can seat separate from one another. I know I've heard from several parents whose kids are doing sports. The kids are going to be asked to sit with the parents in between whenever they're actually doing the play, which that can help because then the parents can help the younger kids stay separate. And that's going to be the big thing, is trying to keep kids together so they can enjoy things, but maybe change the rules a little bit and the common things a little bit to keep the separation. And I think we all need to be prepared but not panic, and that is Dr. Mike's quote from one of a YouTube video I shared early on in all of this. I really think that prepare not panic is the best advice, because we can do it. We can be as safe as we can with still maintaining distance and being smart about it, because we're in it for the long road. This is not going to be a week or two and done. This is going to be quite a while, so we have to learn to live with this and not fear too much, because with all fears we can learn what we can do to help. There are things we can't change. The virus is going to be there, but what can we do to help prevent from catching it? So if there are no other questions, then I am going to say goodbye. So anything? 3, 2, 1. All right. Thanks, guys. See you next week.